We'll start off. Albert, we'll start with you.
So let me ask you in the crowd, in your organizations, is it easy to get things done? Do you feel like you have lots of meetings to have meetings? And what I would reflect in COVID is there's tremendous clarity of thought. We all knew what we had to do. I still remember my first patient in February 2020, which now I knew was probably an index case for us in our organization. The patient was coming back from Asia on a cruise and came with the classic symptoms. And they had me gowned up, and I thought, Jesus, it's going to have to change. To reflect on this, to give you some sense, we had a plan for telehealth. It would take us 2.5 years to implement. Prior to COVID, that's what we thought was going to happen. We did it in 4 weeks. And that's clarity of thought and clarity of purpose. So, and the sad thing for me is, I think the lessons we should learn about how to be able to work together and work quickly, we've kind of fallen back into our old grooves. So we need to reflect on that. I think my colleague's going to talk about that very same theme of saying, what can we learn from the COVID pandemic? What are the lessons that we got to carry forward? So.
Thank you, Albert. So clarity of thought, clarity of purpose, alignment and focus to get things done.
Yes.
Okay, thank you. Miatta?
So great. I think for me, the deepest reflection have been the fact that moving into COVID-19, there was a big reflection for us in terms of the Ebola epidemic and the toll it had on the communities, and the critical role that communities play in being able to curb the outbreak. So communities, population, but also because of all the different measures which was necessary for the public health response in terms of lockdown, quarantine, and the rest of it. The big mental health toll it did have on populations that had to stay indoor for a long time, but most importantly, the healthcare workers, the frontliners that were responding for quite a long time, and the toll it did have on them, seeing people die, but just being helpless in some parts of the world that they did not have the right tools to use, and to just see people go that way.
Thank you. Phuoc, over to you.
Sure. Thank you. Well, gosh, there's lessons are endless for sure, and depends on where you are. But for me, I like to think of a group that expounds the 4 S's, a group that we know quite well, Partners in Health, and that the 4 S's, again and again, are in times of no pandemic, and in times of pandemic are equally important, which is staff, stuff, systems, and space, and the resiliency in the 4 S's. And that you need resiliency in your staff, and you need deep resiliency in your systems so that we can respond in different ways to new challenges. So those 4 S's during times when you don't have a pandemic are what you really need to work on. Every government needs to work on those, and that includes strong systems that interact with the community.
Okay, so Miatta, you mentioned there the importance of the communities and the local communities and learning from your experience both in Ebola and carrying through to COVID. Could you maybe just reflect on what you mean by that? We were reflecting last night the importance of local response, local answers to challenges, but how everything that starts local is also national and global. So maybe would you just reflect a piece for us on your experience through COVID and or through Ebola in terms of the impact on the community, but really the importance of enacting measures with your community and bringing the confidence of your community in order to manage whatever is happening.
Yeah, so I start off by one of the pivotal moments in the Ebola epidemic response was the fact that in the beginning, our relative systems were not in place. We didn't have ambulances. We didn't have Ebola treatment units set up and the rest of it. And we went out there saying that patients should come, when you're sick, report to the hospital, report to the clinics. But what happened was that our response capacity did not match the demands that we were creating. And as a result, the communities did not trust us. Where you saw people die at the Ebola treatment unit door, that had a big toll in our capacity to respond. And when the communities became more comfortable that when they appear at the Ebola treatment unit, they will get care, they started to help us with contact tracing. So a big part of our success of getting to zero in Liberia was the fact when we really were able to beef up contact tracing, when we sat in the war room and could pinpoint which community there was a case, and someone is able to report from another house that there is a case in this house, and knowing that that person will get some level of care. I mean, it's the same thing with COVID-19. So when COVID hit, those structures that have been created in the community was then used to support the COVID-19 response. So communities is where disease starts, and that's where the impact is. And if you get them on your side, the response becomes successful.
So what would you, thinking forward to the next pandemic, and I think reflecting on the fact that we're not really out the other end of COVID pandemic, we are maybe 2/3, 3/4 of the way through, but already many of us were planning to meet with fellows and colleagues for these days and who haven't been able to travel, or they've had a family member who's had symptoms of COVID, so people are still getting COVID. What do you think in terms of the next pandemic and how important the confidence or otherwise of our communities is going to be? And do you think, when you reflect on what we've experienced through COVID and the COVID response, that we will be able to garner the confidence of our communities?
I think the first thing to start out is there will be another pandemic, unfortunately. If we all sit in this room and think that there may not be another one, I think we are fooling ourselves. I think the perspective I come from is that if we are able to now use the lessons that we have learned, be it from Zika, from Ebola, and then COVID-19, thinking through what could potentially be, it could be a disease outbreak, it could be COVID virus mutating and causing a lot of havoc, or it could be we could be dealing with antimicrobial resistance. Yes, it may not be a spread like COVID-19, but it could come gradually, and in places where we have a lot of infectious diseases, we may not have the antibiotics that we need. So as such, we have to ensure that firstly, we are able to sustain the systems that we have built when we had these response capacity. We have to ensure that our workforce is maintained, they are trained, they're able to use the relevant tools that do exist. I mean, it's amazing how fast vaccines were developed, but at the same time, even though we had those vaccines being developed, trust me, it did not reach the places they needed to be. And it was because many health systems were unable to cope with getting the supply chain out there for where people need a vaccine. So we need to be more prepared in terms of re-looking at the capacities we have in our health systems, and making sure that we are able to collaborate. Yes, no one country is able to deal with all the complexities of these pandemic or epidemics. So collaboration at the local level. We have a common saying, when your house is on fire, you have to look at your back door. So don't say it's just going to happen to Liberia. It could be Liberia and Guinea. Thank you.
So Phuoc, do you maybe want to, we were reflecting on this earlier on, do you want to maybe expand a bit on that in terms of what your experience in Vietnam was during the pandemic? And particularly the piece about the local becoming national, becoming international very, very quickly.
Sure. Interesting, even though I'm working in Vietnam now, during the pandemic, I actually was working both at UCSF, and I was the medical director of a small tribal clinic in Northern California, a population of 3,000 that had deep mistrust of the system, deep mistrust of government information, a huge reluctance to get vaccinated, and we had really devastating effects among our tribal elders especially. But now that I'm working in Vietnam, I now understand the incredible power of a strong centralized government that has good public health systems that can mobilize vast numbers of health workforce very, very quickly to do contact tracing or to do testing, and to do it at a very low price. So I'll just give you an example. The national per capita expenditure for healthcare in Vietnam per year, what do you think it is? No, it's definitely higher than $10. Definitely higher than $10. I mean, that's like a Starbucks coffee nowadays. It's $200 per year. And guess what it is in the U.S.? It's about $9,000 per capita. And Vietnam, the country that has 100 million people, had 40,000 COVID deaths. And of course, those are all tragedies. The U.S. has 300 million people and had over 1 million COVID deaths in a place that has what's seemingly like a bottomless pit of money thrown at COVID. So I think that's one of my really, really deep lessons is that we as in the global north should really look at success stories like Vietnam, who are still in the global south, but yet have been able to outperform in a pandemic setting. And I'm not saying that they have the best MRIs, but in terms of a pandemic, the global south has really proven that its resilient systems and quick, strong, centralized governments are huge keys. Yeah.
And along with central government, what else makes a difference? So you've reflected on sometimes money makes a difference. Too much of it actually will not necessarily make the difference you think it will. So you've got strong central government. I presume you mean directing a response. What other things do you think make the difference?
Well, at least in Vietnam, and I contrast the experience that my colleagues in Vietnam had with my own experience in a small tribal clinic, Native American clinic in Northern California, where we had millions of dollars come into our through grants, government grants, and yet our outcomes were so much worse. I think one of the issues is trust, and I think Miatta already talked about trust. Overcoming the amount of misconceptions was so hard, and it really tested my own ability to communicate with my patients. That sometimes everything I said, everything that came out of my mouth was thrown back as, government propaganda, or I was misinforming my own patients. Whereas in a place like Vietnam, say what you want about the government, people actually trusted the information that the government put out. That science came first, and the government led with science. And so the vaccine uptake was quite high in Vietnam, over 95% vaccination rate within a year of having vaccines available. And you recall that the mRNA vaccines were not available in the global south for much, much longer than they were available, when they first became available here in the U.S. So trust was a huge issue, and we have a long way, at least in the U.S., a long way to go to repair the distrust in the government health system that many of our disenfranchised communities, like the Native communities, African American communities, rural communities, the distrust they have in the government. So that's, I don't have a solution to that distrust, but.
Albert.
I dare say, actually, our next pandemic will be brought about or propagated based on lack of trust. Think of our social media channels. Think of all the misinformation that's out there. I don't know what the next bug will be. I don't know what the next pestilence will be, but I think that if we can't have government trusted sources, a clarity of voice and purpose, we're going to have the same problems we had before. We had great vaccines, we had great drugs, but people didn't trust them, and it's a shame. Every person who came into the hospital that was not vaccinated, who suffered disease, I thought to myself, this is really sad, tremendously sad. So.
And maybe, Albert, would you reflect a piece on retaining science and evidence at the core of informing and directing the pandemic response, and what your experience in the US systems has been in that regard? I certainly know our early experience I would say, in Ireland and the UK was that we had a very strong science, and the evidence will underpin what we were doing and will underpin what our politicians were deciding in terms of restrictions and management of our healthcare systems. But as time went on, that narrative around keeping the evidence and the science at the centre of the response was really challenged. And it became harder and harder, and it was because multiple voices were coming through trying to either discredit the science, or you had multiple perspectives on the science, and we were getting quite a lot of misinformation. So could you maybe just reflect on what you thought the journey through the pandemic response from the US perspective was like, in terms of trying to keep the evidence and the science at the centre?
Thank you for the question. Anyone get a shot in the United States and have Dr. Fauci's poster board in their clinics? You guys your experiences? I think leadership's, in times of crisis, leaders lead, and that was tremendously clear. We have a single voice who cites the evidence, cites the data, be convincing. That's really important, powerful. And I don't know about you guys, as the pandemic wore on, I started to get daily updates of data, because data speaks to people, right? How many people are sick in the hospital, what the transmission rates were. That's a tremendous change from previously, where you had anecdotes of disease. Now we actually have real data of disease, and I think that's truly powerful.
So you've mentioned something I was going to reflect on, which is the piece about the data and the intelligence, because I think that's been one of the things through this pandemic which has both been really powerful but also really challenging. So from your perspective, what would you say we learned about the data and about the intelligence and about the systems to gather the data, to report on the data, and maybe if you want to reflect a bit about what you think AI is going to bring, or the benefits, the challenges it's going to bring to us in the next pandemic? Big question, I appreciate.
So one of my career things that I've worked on is really digitization of medicine, right? So bringing about electronic health records and so forth. And I was really quite ashamed to see that we didn't have interoperability. That was a big challenge. We had all these systems that were not connected, and that therefore that jeopardized our ability to share data. So even if we have disparate systems, we need to come together as a nation of nations and say, we need to share data robustly, so we can have a real sense of what any future pandemic in scale and scope is. And so I think it's really something you said about public health, really. How do we share this information so we can work together on solutions? As far as the future, I hope what we do is for AI is to say, use the power of predictive models to actually predict what's coming. What if we learn? We learned today, for example, we can look at the wastewater, and try to predict the outcomes before they happen. We have to pay attention to the signal and keep on doing that.
Okay, that's really helpful. What systems have we to identify the signals and pay attention to the signals? So I'm going to ask both of you, Miatta and Phuoc, to just think and reflect a bit about the data. Miatta, maybe from your perspective on a local community basis, because I think we were all challenged and really troubled with lots of information. Was it really intelligent? Were the systems really speaking to each other? I don't think so. Even in a universal healthcare system such as we run in the UK. So maybe, Miatta, what's your reflection on the data and the intelligence and the information at the local level? And then Phuoc, maybe I'm interested in your thoughts from Vietnam in terms of at a system level how the data worked.
So I think data is powerful, and having the right data at the right time matters in the epidemic or pandemic response. But I think there has to be, which is usually the elephant in the room, the issue of transparency. So if we reflect on COVID and we think about, when the cases appeared in China and the conversations we are having now, there was this whole issue of the timeliness at which you would do the, gene sequencing and all of that. Was the right information coming? We saw that with Ebola also. So I think for me is real-time data, but also transparency around when we start to have cases, to talk about it. I know there's not that incentive for countries to be able to declare, an outbreak and the rest of it because of the political but the economic toll down on those countries. So there's a bit of hesitant in being able to say it. But I think if we are, become more transparent in being able to share data, it really helps to plan your response, and you are able to, avoid, a lot of the misinformation, because there can be some good analysis of, what's coming out of the data. So for me, transparency is key.
I think that's a really important reflection. Phuoc, anything you'd like to add from the perspective, I suppose maybe from what you saw in the US, but what you see in Vietnam in terms of the systems, the data, or the digitization supporting the response?
Sure. And I think in Vietnam, gosh, it's a country that is rapidly digitizing. Information gets disseminated so quickly. And because of the strong centralized government, like I said, most of that data that I've seen, it comes from trusted sources, or at least the end user trusts those sources. That's key, because I think Miatta is onto the right point about trustworthiness. Data can come super early. I'm pretty sure right now, Google is tracking pandemics based on search terms. If there's a town that's 10 people are searching up diarrhea, that's early detection right there, right? And that's happening because, right? Not right around Fairmont Hotel, there's going to be No, I'm just kidding. But that's how early the detection can be. The downside, though, is that in many countries, including this one we're sitting in, people just do not trust data. I've had so many patients come up to me and say, "Well, I don't trust your mRNA vaccine because my cousin Lou had a hernia right after he got his vaccine. So, of course, obviously, it causes hernias." And so I think that, and then because there's so much misinformation, and my huge worry about AI is that local and state actors will take advantage of AI to increase the amount of misinformation out there, to the point where even many medical professionals, I worked in an area in the state that's highly conservative, and I would say half of my physician colleagues did not take the vaccine. Physician colleagues did not take the vaccine. Just reiterate that. Yeah. And so that's what the challenges are in a place that's so polarized and divisive as the U.S. and other countries as well. We've already heard in Europe, but so that's my deepest fear.
How do you think we earn back the trust of those colleagues?
I think it takes leadership, right? You can't have Fauci leading while his boss is talking about drinking bleach, So that's you can't have
poison. Yes.
Right. So you have to have leadership saying the same thing across the board. You have to have the top leader saying the same thing, all the way down to your doctor and your nurse saying the exact same thing.
So you've moved us on nicely, Albert, onto the piece about leadership, and it wouldn't be an Eisenhower meeting unless we spoke and reflected on the leadership piece. I'm not sure if it was with you, but somebody earlier on, I was recalling that press conference and that poor lady who was standing beside the president as he was advocating the treatment. And that's a real challenge when you're in a leadership role. That's a huge challenge. How do you keep the message clear and concrete, and how do you keep the message similar the whole way through your systems when you're in a world where healthcare is abutting into politics all the time? So, Miatta, maybe your reflections on leadership, and the importance of leadership actions in terms of responding in a pandemic.
So, messaging is so key. And sometimes the message is right, but the messengers are totally wrong. Like, totally wrong. I would say I would say in these instances, there's a bit of empathy that needs to surface. There are so many people dying. You know, the way you pass a message in being able to talk about the outbreak has to reflect the fact that they're not numbers, they're human beings. You know, and sometimes, you know, the way politicians will talk about it, we saw it in many countries, which I will not mention. But the way they would talk about it, it was as if they weren't humans. I mean, think about the containers that were out in New York. When I reflect back and think about the dead bodies that were on the streets of Monrovia, you know, when I think about people who never got counted, when I do think about people that went at the back of tarpaulins and their families don't find separation today, they're humans. So as leaders go out to speak about these pandemic, first they need to speak to the population and they need to say the truth. And they should stop lying because the science is there. Yes, you may not believe totally in the science, but that's what you have people on your team. It's a team effort. And we should leave politics. I mean, I feel in some countries, people die simply because of politics. The time people talk politics, the virus doesn't wait. The virus is killing people, and you are talking politics. The message needs to be consistent. And if we don't know, we should tell the population we don't know. And that's the only way we can build trust. If we don't do that, no matter whether we have thousands of dollars, no matter whether we have the best vaccines in the world, it's going to be useless to a response, unfortunately. So leaders have to pass the right messages. And I just want to add another perspective, that if you look over the last 10, 15 years, we are also talking about having epidemics and pandemics in countries that do not have crisis. And I say this from where I stand. There are many countries that are going through crisis, and so we have to also reflect as we think about the next pandemic that you could be dealing with a double sword. We saw it in Congo when Ebola happened in Liberia. It was normal times. But the response in Congo was through an active conflict. And there are many countries in many of our continents that are undergoing natural disasters. So you could have a double sword with natural disaster and a pandemic. You could have a double sword with a pandemic and protracted crisis that we also need to prepare for, because that's in a way going to be a very difficult task in terms of responding. The safety of personnel that respond in these environments is very critical. So this is something we have to also reflect. It's not going to be only be in countries where there is normal times that you can pass vaccines around, you can pass therapeutics around, and we should not forget about research and development. Again, the virus will not wait for us to go to the lab to manufacture vaccines or therapeutics. We should be on time.
We should be in advance, frankly. We wait for instead of we wait until it happens, the crisis happens, and we shouldn't. We know it's coming.
So, Albert, your reflections on leadership actions, and leadership acts during the pandemic that are important for us to carry through to the next pandemic?
So, first of all, I'm going to say something controversial, because why not? It should be criminal to pass misinformation. It should be criminal, but it's not. We as leaders all have responsibilities. And I think that the great servant leaders in the world that inspire us, what we learn from this program, they can really change the world, for good and for bad. So the leadership lesson for me is I try to be wholly responsible for what I say, what I do, and model behavior for everyone on my team, because that's how we got this done last time. How did we get from 2.5-year plan for telemedicine to 4 weeks? It was clarity of purpose and action.
And living our leadership values, which
And
I think
leader
we
values,
heard
yeah.
about in our earlier session this morning.
Absolutely.
So I'm going to get your reflections just on education and what we need to bring forward into our healthcare systems and our future deliverers of healthcare. So maybe if people want to think about your questions, we'll open up to wider questions following on from this reflection. So Phuoc, over to you as an educator and somebody who's a senior role in multidisciplinary healthcare education, as you say. What do you think we learned from the pandemic about how and what we need to do in terms of educating our healthcare workforce of the future?
I'll just say a couple things that there must be at least a foundational body of public health knowledge and know-how that should be required of all people who are going to be interacting with patients. It doesn't have to be like a master's or a PhD, but we're all of us, any of us who are in the healthcare field can be faced, presented with an epidemic at any time. So I remember in my own training in 2010, I was in Haiti, and for those 6 months after the earthquake, we had cholera epidemic. And I had no idea, didn't have any public health training at that point, no idea what to do from a population health perspective. Now I do, but I wish I had some training back then. And then I was in Liberia during the Ebola epidemic. And so it is very, very likely that a healthcare professional, nurse, doctor, respiratory therapists, all of them, it's community health workers, will face a pandemic or more than one in their professional careers. So that's one. And then the other reflection and recommendation I would have is to teach, some people call it social determinants of health, other people call it structural determinants of health, but to be able to, as a health professional, to go to a community and map out in a very short time, create a barrier map, create a mental model of why there is health disparities in that community that you're taking care of. And so that's what I would teach my medical students and fellows in the programs that I've run, is that things don't happen just naturally. Things happen to people. Recently I had a senior Navajo nurse tell me that the Navajo body was the perfect medium for COVID-19. So what does that mean? The Navajo person's body was the perfect medium for COVID-19. And it's because of hundreds of years of government neglect and impoverishment, lack of running water, electricity, things that a doctor like myself wouldn't necessarily know unless I was looking to understand the structural reasons why people are susceptible to COVID-19 and its effects. And so that is so key, and I think we don't teach it enough, but it's required reading, required knowledge.
So pandemics exploit inequality and disparity, always. Okay, Miatta, your reflections on education, training, and what it means as we move forward.
So one of the things we did learn in the Ebola response, and I think is relevant for COVID, is that none of us. So I trained initially as a nurse, and one of the things that we were very particular about was infection prevention and control. Unfortunately, in a lot of our hospitals, that wasn't the case. So there's lots of training that we were able to run in terms of keep safe, keep serving, to make sure that health workers already in service would be refreshed in terms of what to actually do. That just wearing gloves is a simple thing that you can do to save your own life. So I guess people will go through their formal training, but there is a need to pick up all of the lessons you've learned, and redo it with medical students, redo it with nursing students, redo it with public health students, because it's a lifelong learning process. Learning doesn't just stop. With all the care that we give to Ebola patients, we learn by doing. And some of that is what have basically remained with the response that we've had to COVID in Liberia. So it's a lifelong learning process, and we should embrace, what we've learned during these response.
Okay, thank you. And Albert, your reflections, and I'm interested in your reflections on what we teach people and what we learn about information, informatics, digitalization.
So I dare say, yes, we could have formal public health education and have had some, but all of us in this room have a responsibility. Right, all of us have the tools we need. We need to be able to be leaders, to be able to communicate, to share data, and actually the responsibility to process data, to understand data, because that's clear. And to say, sense of epidemics, we don't have to wait for the next COVID. We have epidemics in our communities today: chronic disease, diabetes, hypertension, congestive heart failure. We have a role to play today. All of us, even if you're not a formally trained health worker. We can make a difference today, absolutely today.
Okay, thank you for those reflections. I think they've been really interesting. We have about 15 minutes, 20 minutes, so happy to open to questions. This lady, I think, was first.
Oh, sorry.
And then we'll come to you next time.
Thank you.
Okay, so yourself, then this lady, and then.
Thank you. My name is Ahmed. I'm an Eisenhower Fellow 2017 from Pakistan. I'm a healthcare VC and an operator. So I'm coming back to your point about countries that are more centralized authority or have more trust. So my question, I'm going to frame it. I'm very confident if you do a research, you'll find that democracies fared much worse in tackling of COVID than non-democracies or quasi-democracies. So in a sense, countries that were top-down, command control, a more positive relationship with authority, where the collective, the family, is more important than the individual, which is mostly the case in democracies. They've done much better in terms of the COVID response. So is there a cost of democracy in terms of having more deaths? That's my first question. My second question is... That's a big question.
Stop there.
So, my second question is, you talked about data, you talk about transparency, but I tell you something which is more potent and quicker than data and transparency, which is the judgment of an expert. See, it can happen because data is always lagging, the judgment can be leading. So if you rely on experts and you don't have to disclose, you have to trust them, then that could certainly, in a pandemic situation, be more valuable. And thirdly is that we've historically been a doctor-centric, hospital-centric healthcare system, mostly in emerging markets. Is it the case that we are going towards a paramedic and more point-of-care need? We went to that in the time of COVID. Have we returned back to a doctor-centric model, or you think that's permanently shifted towards a more paramedic or nurse-led and a healthcare at the point of need healthcare service model? Thank you.
Okay, so three really important things there, but I think maybe let's think about the Phuoc, maybe will you just reflect a bit on the democracy piece? For me, there's a piece about the type of leadership at points in time.
Yeah. Oh, we can. Did you want to retitle this "Democracy Kills" or something? Well, let's just compare. I mean, obviously, I don't have a comparison of 190-something countries, but let's just compare Vietnam and New Zealand, right? Vietnam, very strong centralized government, but why did New Zealand fare so well? And correct me if I'm wrong. It's a democracy, right?
It's an island.
But yeah, New Zealand, I think many of the connections are still directly applicable here. I think strong central leadership with a trust in the message of the government, science-led in both places. And yeah, people had an adequate vaccine uptake. So I think, I don't think it's democracy that kills. It's the, I think it's the trust in your leaders, which we talked about ad nauseum today, is one of the key things. And if you, I'd love to see some case studies of the biggest democracies versus the biggest, more like strong central governments.
And I think what I would add is the intentional choice towards a type of leadership during the crisis. I think there's something about, there are times when you need command and control. but there are times when that's not what you need. So there's something about the flex and having the skills to flex between the different types of leadership, quite apart from what kind of a political system you have working in your country. Okay, so this lady is next. I think it's on. Hopefully we can hear you.
Can you hear me?
Yes, we can.
Okay. So my name is Barbara Leither, and I'm a USA Fellow from 1995. And I wanted to say thank you to all the healthcare professionals in the room. I am not a healthcare professional. I am an average citizen who was living in Seattle during the pandemic. And my life changed instantly overnight. And one of the things in reflecting back on COVID, just as an average citizen, and by the way, I have not had COVID because I did get all the vaccinations and I did everything that was recommended. But one of the things that I keep thinking about is I'm angry and I feel as though there are unresolved mental health issues, almost like trauma, from having to have my support systems yanked away, my church, things like that affected me so much. And I'm fortunate that I have a strong support network. But I'm wondering, question number one is whether or not, what do you do about the long-term effects where there may be people who are still traumatized by this experience? And then I guess the second question, which is related, is having, as a globe, gone through this entire pandemic, was there anything that we can say that happened that we learned that was good from this experience? I can think of one, and that is I learned who my support networks were. And I learned how important my community and my neighbors are. So those are the questions.
So thank you. I think two things I would say. One is I'm very glad you reflected on the healthcare workers in this room and in the wider systems. We think a lot about the people who lost their lives, and they were patients and they were healthcare workers. I think we sometimes forget about the people who gave their lives for 2 years. They came through it, but their entire lives and their entire families were completely disrupted because they just worked and worked and worked to come out the other end. So we were planning before we finished just to acknowledge, from our perspective, all everybody has given. I think you rightly described the real difficulty in the middle of this, which is the disruption to individuals who are of a social nature. Everybody is built to interact and socialise with their family and friends, and that's what had to be disrupted, and that's the huge impact of this. And I think that feeds into Miatta's reflections about community and the real difficulty with this kind of a response where you have to disrupt people meeting, you disrupt the entirety of the community. But you're relying on that community to affect the response. And I think there are two sides to that. It's really difficult, but we also saw, certainly we saw across Ireland and the UK, huge efforts on the parts of community to bring people through. And it's only because the communities enabled us as senior healthcare professionals to do things that the response was actually successful. If communities hadn't worked and hadn't come along, then it would never have been successful. So there's a really difficult bit in the middle of that, but there's a really good piece as well. Miatta, would you, or Albert, do you want to say something on that, Miatta?
That's kind of why when we were prepping for this session, I thought it was a misnomer. We said after COVID. COVID's not over. Those of us who are raising children are still seeing the effects of COVID on their education and their social development. We have lost colleagues they made it through COVID, but they died by suicide after treating patients. There's lots of things to learn still. So it's not over just yet.
Yeah, we have some way to go.
Yes, definitely it's not over. I mean, just a week before I came, 2 of my colleagues were infected with COVID-19. So it's obvious it's not over. And I think the big challenge we have moving forward is addressing mental health. In a lot of our countries, there are now structures in place, and with the the trauma and everything that people did see, we still have a long way to go to be able to care for the caregivers who have to be ready for the next one. But like you rightly said, communities have really come together to support each other after these difficult moments. And I'd just like to mention, something that happened in Liberia, reflecting on communities being involved, but that sort of supportive function. So in August of 2014, when we were at the peak of the epidemic, we could not, the dead bodies were so many. It was raining season, the water levels had risen, and even the graveyard, communities did not allow us to bury the bodies, so we couldn't do soil burial. And at a certain point in time, President Sirleaf had to announce that we were going to do cremation, which culturally is not, acceptable, but we had to do it to get rid of the dead bodies. And we realized that because we were, unable to engage the communities in a way that, they were on our side, it was a race against time. Community members started to hide loved ones that die. And the simple thing that we learned was that because they wanted to be involved as part of the burial. And we quickly was able to convince the government to buy 25 acres of land, which we were able to lay out. And the landmark is still in Liberia today, where we were then able to shift our response in terms of dead body management to allow the dead body management team to do burial, but families could watch that. And I can tell you that really helped with people trying to find closure. So whenever it's Decoration Day or Memorial Day, people have a place to go to. Whereas some people at the beginning, when we had not sorted ourselves, it was very difficult. And so communities became very supportive, with accompanying family members to watch the burial and the rest of it. So I think there are really local solutions and there are ways people can help, but mental health still remains a challenge moving forward in a lot of places.
Do you want to reflect on that?
Yeah, we have this PT, CSD, post-traumatic COVID stress disorder, and it's collective, and it's not just adults, but especially our children. I raised 3 kids, locked down for a year and a half, and we're still paying the price now. But let me talk about one good thing, which is this advent of this new technology, mRNA vaccine technology, a technology that was poo-pooed for a while in the scientific community as too risky or maybe on the fringe. And look what happened during the pandemic. It rapidly created a vaccine, and they just won a Nobel Prize a couple weeks ago for that, and it saved millions of lives. And this technology is applicable not just for COVID, but many types of diseases, of infectious diseases we can develop vaccines for. So of course, would I trade COVID for no, I wouldn't. I wish we'd never have COVID, but I do know that many lives are going to be saved, COVID and non-COVID lives, because of this new technology.
Thank you. Okay, next question.
I think it was steady.
Around
Telehealth.
Yeah.
I was hoping you were going to add that, man.
Yeah.
Telehealth, yes.
Great, thank you. Okay, Teddy.
Well, so thank you. Teddy Tatima from Ghana, 2016. It's been striking for me in this time, after what COVID has done, that we still don't know why COVID did not do much in Africa. Mm-hmm. We expected COVID to decimate Africa, but it didn't. And that question keeps coming up. Why didn't COVID do more in Africa? And for me, what's disturbing is that we still haven't had any evidence-based approach towards asking that question. I mean, everybody's asking that question in the scientific community, like, why is the sky blue? But we are not putting any research to answering that question. And one thing that I thought that COVID would do would be to sort of redirect research to Africa.
Exactly.
But it hasn't. I mean, Africa is still having the least research, even though, it's the reservoir of human resource for the future. It is the, the reservoir of all genetic diversity. And nothing is happening in terms of research. I mean, COVID was conquered by technology. And what's distressing for me is the fact that we're not creating anything that enables technology to be developed in Africa. And if we do not enable Africa to have the tools for precision medicine, for enabling research, and it's going to be the human resource deep reservoir for the future, then, this is a comment, but I just want to find out what your thoughts are on Africa and COVID and what we could do about more research, because nothing is happening as far as research is concerned, where it should be.
Thank you, Teddy. Maybe I'll start. I think it's fascinating. It's the underlying piece you've described, that COVID did not do what it was expected to do, is really fascinating, and I think it's really disappointing that we're not we're not investing in understanding and asking that question. And I absolutely agree with you. It's something that time and energy needs to be put into to really understand. I think it's also alongside a lot of the other things certainly we did or we responded with. We've not continued. We've pulled back some of our technological investments. So we kind of steamed forward to get through COVID, and then we got through, and then we are in some aspects dismantling some of our response aspects. And I think that's a challenge. I'm not sure if you guys think, but that's a challenge I really see across our healthcare systems in Ireland and in the UK. I'm not sure if we're really capitalising on even what we learned. But I very much agree with you. So if we have any funders or researchers or people who have an into that area, I think the question you've said about why COVID did not do what it was expected in Africa is absolutely fascinating. And it may not be something that's purely scientific. It may be to do with community, cities, the urban way of living. It may be a lot more than just the actual characteristics of the SARS virus itself. And if you guys want to reflect on that?
I mean, I guess what I would say in the beginning, what I said, right? Research and development. And if we reflect a little bit about, again, going to Ebola, because the COVID vaccine was developed in rocket time, but see when the first, Ebola virus was discovered, and when we had a vaccine, and a lot of effort that was placed in getting Ebola vaccine really saved outbreaks that have come after the 2014 one in West Africa. So I think we should not stop. There's still a need to continue, to look into the different tools that we could use. Yes, we have the COVID-19 vaccine that all of us maybe have taken, but we also are aware that we, quote unquote, do not know how long it's going to, stay with our immunity and the rest of it. So I think there's still a need for research into these tools. But just as Teddy has said, I think I like to put it back to the continent with us looking at why wasn't so much, of an impact in other places as it is. Owning that sort of thought and moving into research, for the future of doing that will be very important for us. So of course, research and development is very key for us to look into in preparing for the next pandemic.
So I'm conscious we're coming up against time. Any last burning questions anybody wants to raise, or any reflections anybody wants to offer before we finish? Diane. Oh, Diane.
Thank you, Lourda, and thank you all for brilliant presentations. Thank you, Teddy, for the microphone. So given the anticipation that there will be another pandemic coming, just wondering, each of you, what you would recommend to your respective ministers of health to get out in front of it, and what international bodies do you trust for statistics and information?
Okay, Miatta, you start, then we'll go to Phuoc, then Albert, and then I'll finish. Okay.
Do we trust any of them? Well, let's take it home a little bit. I think governments have to do firstly justice to themselves. Like, I mean, I worked for the ministry for 6 years in Liberia and sat at the senior management team. A lot of time, ministries of health, what they ask for is money. But when the Ministry of Finance asks them to justify why they're asking for so much money, it becomes difficult. So I think the best thing that we can do is not just to have, our national health plan or response plan, but to actually be able to put it into motion. It's only by putting those plans into motion and demonstrating impact that we will be able to raise money, for future response and the rest of it. And I think ministers of health who have to, stand ready to communicate to their population. I still will go back to the issue of, trust, because that's going to turn everything around. The messages we pass to the population, and the rest of it. Ask me which body I trust. I think to a certain extent, we have the World Health Organization, we have the Center of Disease Control. I think we should believe in the science. I think we should have our suspicion, but we should believe those things that can help move us forward. It's never going to be 100% in my view, but there's still a need to, to trust these, multilateral bodies, because it's only with those kind of collaborations that we're going to succeed in being able to do it. So yes, trust a little bit, but we get there.
I agree with WHO. I actually did some work in the UN system previously, and they're very, very dedicated scientists, extremely dedicated scientists. Yet it doesn't have a strong enough pulpit voice around the globe, especially in the US. Right? In terms of what we can do now to work on in anticipation of the next pandemic, I mean, we didn't actually touch at all on climate change, guys. That could be another hour or a couple hours of discussion, but I'll just go back to what I originally said about learning the lessons. Is that we need to focus on the 4 S's, which is staff. We need to have a resilient health workforce. Stuff. We need to have plenty of PPE, on reserve, stockpiled, and anticipating, the next pandemic. Systems, strengthening our systems, especially cross-sectoral systems. Ministry of Health needs to work really closely with the Ministry of Finance, which works really well with the Ministry of Education, so on and so forth. And then space. We need to have places like ETUs, like Ebola treatment units, and clinics and hospitals that can actually handle the anticipated larger volume of patients when you have a pandemic. I mean, in the early days at UCSF where I worked, we were putting up tents. We were putting up tents and cots because we did not have enough space for all of the COVID patients. So even in the most resource-rich places, space was still very much a barrier.
Albert.
In addition to what my colleagues have said, I'll say this. I try to teach my kids to do the right thing even when no one's looking, right? But do we do that with our investments, our societal investments? So we need to continue to invest. We have these lessons learned. We need to continue to invest in infrastructure, community support, things like my colleague Jill are doing. Thank you, Jill. Just going to call you out loud. I mean, we need to really continue to invest in our communities because that's what will help us in the next pandemic. And usually what we do is we wait for the spotlight to turn on for us to do anything. That's the wrong answer.
And I guess I would add to that, if I had a health minister, which I don't have at the moment, I wish I had, I would say it's whether you're going to pay for your insurance or not. You have to invest, and it's not just the money. I think it's the people, it's the systems, it's investing wisely. But you have to know that you're going to pay for your you're going to pay your insurance premium, because if you aren't comfortable or willing to pay for your insurance premium, which is all of the investment in the systems and the people and the space and everything else, then you're not going to have it when the time comes. And as we've all learned, it's extremely hard to turn it on if you don't have it. Really hard, because you end up disrupting the rest of your civil society, stopping lots of other things in order to be able to mount the response. So I would advise any health minister that they need to get their insurance well worked through. And they need to have their Minister for Finance as their best friend.
Yeah, exactly.
Because it's the only way that you can really do it. So it needs a lot of people, resource, time and money investment.
Do you want to do the stand-up for? Do you want me to do the stand-up? Yeah. So can we all please stand?
So just before we conclude, we're just going to take a couple of minutes.
Yeah. So there are two reasons why we stood up, and thanks to our colleague, for recognizing the tremendous efforts of responders, health workers all around the world, all around our continents, all around the countries that we all represent, for the tremendous work that they have done over 3 years. They really deserve a lot of recognition for sticking up their lives out there to save the world. COVID is not over until it's over in every country. And COVID is going to be here with us for quite a long time. We have to embrace it like any other disease, follow the rules that have been given so that we all can be in a safe world. Yes, it's a world of uncertainty. And because we recognize it's a world of uncertainty, we know that anything can happen, which is why we are having the conversation, the what's next. And it could be anything, and it could be anywhere. And as we close, let's observe a moment of silence for all the health workers, all the responders, all our family members, everyone in every country around this globe that lost their life to COVID-19. It's quite a tragedy for the number of human lives that we have lost. And so we just take this moment as we close up to observe a moment of silence. Thank you very much.